All right, next chapter, we are looking at chapter 13, concepts in injury prevention. So we're going to dive a little bit into the corrective exercise stuff today, but obviously not as intense as the actual corrective exercise thing. We are just going to look at some very common injuries and what a lot of their common causes are. So we want to understand like the frequency of, we want to be able to understand the frequency of injuries and how they are problematic in the world of athletics, the mechanism that causes a lot of those injuries, what some of the risk factors are, and how to incorporate specific exercises to kind of combat those injuries. So obviously injuries are super problematic for literally everybody, but this book is like, but it ruins your athlete's season. It's like, yeah, they're bad for everyone. So there's a lot of like concepts related to these injuries here. They're very common in athletics because athletics are very exaggerated versions of like physical feats, right? You know, they're much more, God dang it, stop it. They are much more common in athletics because you are doing such a higher intensity than you would in your normal everyday life. So we need to make sure that if we know that that's just like a true thing, we know that we need to come up with a strategy to prevent these injuries from happening. And we need to be able to have a backup plan for if the injury does happen, how to get our athlete back on the field as quickly as possible. So first one we're going to be looking at are foot injuries. Now, I got to warn you guys, the notes here get really weird. This PowerPoint is always a little awkward in the world of note-taking, just because like it doesn't really flow quite as well as some of our other PowerPoints. So what I'm going to do is normally what I like to do is I label it like sections. So we'll start with like foot injuries, okay? Obviously traumatic overuse injuries that are very common are going to be things like Achilles tendonitis, which is inflammation of your Achilles tendon. Very, 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 very common in sports. Very, very common. You know, if you have a tight gastrocnemius and soleus, you got to remember your Achilles tendon, if you look at it, if you look at the anatomy of it, it's traveling down from like your soleus and then it wraps around your heel here. There's a lot going on there, right? See how it's beginning to wrap? And then if you look at your next injury that's very common, plantar fasciitis. I really wish Maggie were in the call right now. Okay, so plantar fasciitis, when you look at it, again, your plantar fascia is it's inflammation of this webbing on the bottom of your foot there. So this wraps all the way out and around here. Tightness in either of those can cause overuse injuries because they start to rub on the bone, then they get inflamed. And once they're inflamed, it's very, very difficult to get them to sort of calm down because it's your feet. Like, what do you know, the best way to get, anytime you see itis, it means inflammation. And you know what the best way to get inflammation to go away is? Rest. How the frick are you supposed to rest your feet? Like, you have to walk on them for literally everything we do. And so that's why like plantar fasciitis is such a nagging injury that people deal with for such a long period of time. So Achilles tendonitis is a common one. Plantar fasciitis is a common one. And metatarsal stress fractures. Ugh, foot injuries. So remember, if you're looking at your metatarsals, remember our normal like arrangement for our body, right? Like mammals have what is called the one bone, two bone, lots of bone structure. I know that sounds like a bad Dr. Seuss novel, but that is what it's called. And basically in our limbs, all mammals go one bone, two bones, lots of bones, and then digits. And so you have like your main arm bone, your two forearm bones, you have your you have your carpals of your wrist, which are all these little tiny itty bitty bones. Then you have your palm, which are your metacarpals, and then you have your digits. Well, the same structure is, I'm gonna sneeze. Okay, the same structure is true in your legs. You have got One bone here. I just realized I went out for a swim this morning and I'm wearing my shirt still, and that might be weird on camera. Big reveal. One bone, two bones, and then you have lots of bones in your ankle, and then you have your metatarsals, which is like the palm of your foot, quote unquote, and then you have your toes, right? So your individual digits. So these right here, these are your metatarsals, and these are they're considered long bones, and they are very commonly stress fractured. So when you see a metatarsal stress fracture, what that is basically through like lots of running, you're gonna see, and it doesn't look very intense here, right? You can't really see like very much of like an actual break, but what happens is, and you can see this person was heading there for sure for a long time. They've got like some bone spurs here, and then like this is all out of alignment. Probably somebody who deals with I would assume they have bunions. I'm not really sure. It doesn't look like that bad of an angle actually. But you see like what is happening because of this like big gap here. This bone is taking a lot of extra stress. Also, these nodes here are probably causing like more rubbing and stressing sensations. And so like this bone literally experienced what is sometimes called a torsion fracture. And basically, remember your bones are all of these like it's this like honeycomb, right? It's this honeycomb of all these individual little fibers, and when they twist, they can fracture. Like you can break that honeycomb, and all of your weight is coming down on your foot all the time. And so we see like little tiny stress fractures here. Here's another example. This is actually a really easy to see example, right? Where we see like a really large kind of gap in there. That's a very intense stress fracture. This person's also bunioning a little on both sides, actually. That is a very, very, very common like foot injury. So how the heck do we keep that from happening, right? How do we like prevent these types of injuries? Well, the mechanisms for Achilles tendonitis and plantar fasciitis are pretty darn similar. Your big risk factors here are really overactive calf muscles. Because what is happening is like those muscles get tight, and then maybe this section of fibers doesn't decide to like move, right? Like let's say the upper part of your calf has some type of like let's say you were playing sports and you got hit in the calf really hard, or maybe you strained your calf muscle, you pulled your calf muscle. So what happens is like we go through that cumulative injury cycle, right? The first thing is like trauma is going to occur, and then that's going to cause like inflammation in that section. And so then maybe scar tissue starts to form, and then that part of your calf is now like protecting itself by staying really tight. And so now the rest of your calf has to like make up for that loss in mobility, which means it's now being overstressed. Or maybe it starts to rub on the bone and cause inflammation in, again, Achilles tendonitis and plantar fasciitis due to limited flexibility. The one section won't stretch, so the rest of the muscle has to, which means the rest of the muscle might start rubbing on the bone. So those are very, very, very common injuries there. Our biggest risk factors are going to be clients who have tight calves. So when it comes to stress fractures, also a very similar thing. This usually comes from somebody who has a really inflexible foot. So now when we go back to like plantar fasciitis, that plantar fascia getting really, really tight can sometimes lead to stress fractures. So plantar fasciitis and stress fractures have a real common ancestry, I guess. I don't know. They're very commonly like related to each other. And so if you have like a really rigid foot due to like being very inflexible, that can sometimes lead to those stress fractures. Or if you have a really weak foot as well. So we want to make sure that we're strengthening our feet. So how the heck do we do that, right? Well, we can strengthen our calf muscles and make sure that they are properly mobile. So doing plenty of like calf exercises while also continuing to work on mobility is absolutely going to be key. So foot injury prevention. Now, I know I'm not teaching you guys like the specific exercises in this course. These are the things that are going to come up in capstone. So when you get to capstone and it's like, all right, let's talk about, and it's going to be how to work on foot injuries, ankle injuries, knee injuries, all the stuff we're kind of mentioning today. We really just want to teach you what the common injuries are. You'll talk about how to fix them in the corrective exercise class. So foot injury prevention, for the most part, is going to be your biggest thing is to ensure proper range of motion in the foot and ankle complex. Okay, so that is going to be, it goes to ankle next, yeah? Yeah. That is going to be proper extensibility. Actually, I don't need to do that. Proper extensibility of the calf muscles and proper strengthening of calf muscles, anterior tibialis, which is huge, by the way, and toe flexors. So toe flexors are also a really big one. Another common injury that's not mentioned here is, has anybody ever had turf toe? Ugh, turf toe sucks. Jay? Yeah, I was gonna say. Sprinters, man.
Yeah, because like my drive phase, my first step out of the block to my back leg, I have to, actually my second step, I have to drag my toe in order to keep a low ground, level of ground contact, I guess.
Yeah. Do you do towel scrunches?
No, I've seen that though. Yeah.
You might look into it, man. I'm actually gonna I'll pull a copy up here. Oh, come on, really? Can I not search for words? Yeah, come on. Towel. Oh, he's just searching slowly. Whoops. Give it just a second and we'll find this. Towel scrunches are great, by the way, Jay. I know it looks kind of silly. Oh, they're calling it towel pulls now. All right, fine. NASM. You do you. So this right here might be one of your best exercises to prevent that turf toe. Turf toe is a real freaking pain. It feels like gout. I like to use this as a this is really good for plantar fasciitis as well, guys, and this is also really good for metatarsal fractures. So I like to use this as a balance exercise, and I will throw it into my movement prep, and basically you just stand on one leg, put that towel on in front of you, and then like I usually use, a lot of times when you're using this, you have like access to like hurdle, like those little baby hurdles, or I'll use like those pipes, shoot, what are they called? The parallel bars, the little tight ones that are low to the ground.
Yeah.
Hurdle about this high,
Yeah, yeah.
My clients will have them stand on one leg and get a towel, and then they will pick it up with their foot and drop it over to the other side, and then like I make them return, and then they pick it up again, and drop it to the other side, and then I make them touch. And I just make my clients go back and forth like this. I know it's silly. I know it seems like, hey man, I'm here to work on my freaking biceps, okay? I get it. It's like, get me back to squat land. I get it. But trust me, like that type of exercise is a great way for you to not only work on your balance, it's a great balance stabilization exercise, right? I'm not moving my balance leg. So that is a balance stabilization routine. But at the same time, I can work on like that toe strength. It's a little integrated. If I have a client who's like really older or like very, very new to the gym, and I know that they can only handle one thing like this at a time, I'll have them sit in a chair and just work on their foot, But if I have an advanced client who I'm trying to knock two things out at once, where I get a little bit of balance training done and I do the corrective exercise for their foot, that is a super, super great exercise. Again, I really wish Maggie were here with her plantar fasciitis. Maggie, you're probably watching this video. Eyes on you. But yeah, Jay, you might look into doing that just as like part of your like warm-ups and stretches. Like when you're doing all your anterior tip work, throw that in there. It can really help. That reminds me, strengthening that anterior tibialis, absolutely huge. That resisted toe flexion. I'm sorry, toe flexion. Talking about towel crunches. Resisted ankle dorsiflexion. That stuff is huge, right? It's simple. It's not much of a big exercise, but again, just pulling your toes back this way. Like let's say you've got your ankle like this, you tie a rubber band pulling you this way, and then you resist against it and perform that ankle dorsiflexion. That's a great way to strengthen that and get plantar fasciitis, to get Achilles tendonitis to go away. Because remember, the reason that's going to work so well is a lot of times people complain about like working on their flexibility for like years and years and years. Like I work on my flexibility, I stretch and I stretch and I stretch and it just doesn't get better. Well, remember, it's two sides of a joint. If you're only stretching out one side of the joint and you're not pulling and strengthening the opposite side of the joint, you're not going to get the same results. So we need to like get better at dorsiflexion through stretching, and then we need to strengthen dorsiflexion with the anterior tibialis. So let's go ahead and look at ankle sprains. These are also very, very common. So ankle injuries. Right. Ankle injuries, the most common sports-related injury. Good Lord, now someone loves to say that. It's in literally all of the text. It's in 4 textbooks that I know. But it is. The lateral ankle sprain is the most common thing that any athlete experience. Super high re-injury rate, super like time lost during the season. So lateral ankle sprains are where you are going to tear this ligament. So what ends up happening is somebody basically steps with excessive inversion, and then because of the limited flexibility here, this ligament tears. So here's your ligaments right here. So the one that is attaching your fibula to your calcaneus, that's your calcaneofibular ligament, or the one that is attaching your fibula to your talus here. This is a little less common. This is the one that often happens, is like this lateral ligament right here. So big risk factor that we're going to see in the PowerPoint is a client who excessively flattens their foot. Lord knows we've talked a lot about foot flattening, right? We spent a lot of time talking about that excessive eversion of the foot. So when they stay in that everted position, you know, which is obviously the opposite of inversion, right? So a client who is sort of pronating constantly, remember, it's this ligament right out here. This is in a shortened position. It's now getting to live its life, getting used to the fact that it is not stretching. Oh, hold on, my internet's crapping out. Should be enough time. All right, so somebody who is excessively everting their foot, this ligament stays in a shortened state. It doesn't get used to being stretched. Then something happens and this person clips their foot and they roll on this outside here. Now this should be able to stretch whenever you invert your foot. But because you spent so much time in eversion, it got used to being in a shortened state and then it tore. So we want to make sure that we have the ability to invert our foot without spraining our ankle. Risk factors include a history of sprains, obviously. We know that very high re-injury rates, that's a big risk factor. Improper shoe wear. I promise I did not put this in here, by the way. But improper shoe wear that sort of promotes that eversion of the foot or promotes ankle plantar flexion instead of dorsiflexion. Or it's also just talking about like not wearing athletic shoes and trying to do something athletic. And then poor balance is actually key here as well, because you end up like improper balancing. So then you take a missed step and sprain your ankle. So those are big risk factors there. Medial ankle sprains are also, they can happen. They're not very common. Medial ankle sprains are going the exact opposite direction. If you had a client who, you know, has excessive inversion, obviously it would be much more common. But if you were to like evert this way and step on the inside of your foot and overstretch this ligament here, that is a sprained medial ligament. Not many people do this, but it can happen. And the reason not people do it is because so many people pronate, right? And then high ankle sprains. These are usually high ankle sprains are going to happen from like an actual like get it like a contact injury, or it could happen like while you're wearing like really rigid boots. So high ankle sprains, like I said, they're going to be like this ligament up here, and another one as well. Good picture. Oh God, not that picture. Good Lord. Come on, 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 come on. There, by the way, there it is. That's how it happens. It is often a contact injury. There we go. That'll work. So this ligament right here that is crossing over, that holds your tibia to your fibula. Now we were looking at this one here, that ligament that attaches your fibula to your talus. That could be part of a high ankle sprain, but another one that is really common is where your tibia is held together with your fibula, and there's all this fascia in here. Again, that's usually a very, very contact thing. Or if your client is wearing, like, this is also very common in the military, super, super, super rigid, like boots that are all like laced up and tied together. It means that like your tibia is the only exposed part. So it's doing a lot of movement from like up here, but your ankle is all kind of like cinched together as one big thing. But then that bone starts to move from up above, and all the stuff down below can't move. And so it literally like kind of dislocates. And that causes that high ankle sprain.
You can utilize that method that you were showing me at the park of distraction, right, to kind of help bring them back.
You would do it for flexibility purposes, definitely not while they're injured. But yes, absolutely, Jay, that would be really good. Yeah, you might have like some dysfunction here. Yeah, I'll give everybody the kind of the talk on that. So if you guys are, let's say you're doing like a soleus stretch, right? So I'll show you, like, let's say you do, like one of my favorite soleus stretches is using like a bench. This is a little higher than a bench, but like you would take yourself up like this, and then like just place your hand on the bench here, and you're literally just kind of bend. Okay, my bed is way too squishy. Can you guys see if I use? Yeah, okay. So I'm gonna go forward like this here, right? So I'm going into like some pretty severe dorsiflexion here, right? You can see like that's a pretty intense angle. So I don't have much of a pinch on my left side. I'm only feeling a soleus stretch when I do that. But now let's take a look at the right side. My right side's not quite as flexible. I don't have as much dorsiflexion on my right. So if I start to go forward like this, I get the soleus stretch, but I'm also feeling a pinching sensation right here. I'm feeling a pinching at the top of my ankle. If you're getting that kind of pinch, oh gosh, we will talk about that. So when you start to get like that kind of pinching sensation, a lot of times the reason that's happening, I'm just going to pull up a different picture, foot and ankle anatomy. What is happening is your fibula, or I'm sorry, your tibia has kind of slid forward on your talus. So here's your tibia, right? This big bone right here. Oh God, I can't do it with that picture. I don't know. That one. Oh, nope. That one. All right. So take a look right here, right? You can see here's your tibia, here's your talus, right? Now, this bone, you can see like it sits in this kind of groove here, right? And it's supposed to sit up kind of high like this. What will happen a lot of times is that this will kind of slide forward and fall down your ankle a little bit. If you are doing your calf stretches, guys, and you feel a pinching sensation right here, the reason is because these two bones are not in the alignment that they're supposed to be. So what you can do to fix that is called distraction. Distraction is actually a method where you actually move a bone manually using like your hand or using a piece of equipment, right? So like, if you, and you can kind of feel, but like take your forearm and just kind of squeeze, and you'll sort of feel those two forearm bones. You're kind of pinching them together. You're kind of moving them like this. Like they're sitting next to each other, and then you squeeze like this, and you'll feel they'll kind of come together like that. That's just, you are distracting your forearm. Distraction is anytime you are kind of manually moving a bone. I used to get like really bad lockjaw, and I would have to like distract my jaw to get it back in alignment literally every morning when I woke up, because I used to grind my teeth in college when I was super stressed out. When I get stressed, apparently when I sleep, I grind my teeth. Wasn't even aware of it. Anyway, I started to get like I got like really bad TMJ. And I used to have to wake up every morning, and I would take my hand like this, and I would find this little groove right here, actually, which is like the outside of like my eye socket. And I would place my hand there, and then I would run it down and push on my jaw and get it like back into alignment, and then kind of like circle, and I'd be fine. But every morning I'd wake up and I wouldn't be able to open my mouth. And so like I would do that and it would fix it. I would distract the bone. So distraction is anytime you are manually moving a bone. So you can apply a little, if you are getting a pinching sensation here, and that's keeping you from being able to stretch your soleus, you can use distraction. What you're gonna do is you're gonna wrap a resistance band around your shin, and then tie it to like something super solid, like a squat rack or something. And then you're actually gonna step forward. That'll allow the resistance band to pull the bone back as you lunge forward. Now, you could also just do it manually. It's just really hard to do it on your own body. So if I go here and I start like lunging forward and I start to get that pinching sensation, I can technically, although again, it's way easier with a resistance band, grab my shin here and pull backwards. Then as I lunge forward, I put the bone back into its neutral position, and then I go into a stretch. It works way better when you have somebody doing it for you, but I'll do that with my clients. I'll wrap my hand around their ankle and pull straight back. That'll distract the bone, pulling this back into a neutral position and allowing them to stretch further. So that's an example of distraction. You guys are going to learn some distracting techniques when you get with Mo. He's going to teach you a couple of those. Ones that are like really common. There's a lot of distracting techniques out there, but you'll learn some of those basic ones. And then actually, Jay, just real quick, last thing on this. Oh my God, I just saw myself lag on the camera. Let's see here. Squat university ankle distraction. I'm sure he's got, this guy does such a good breakdown of this stuff. I'm sure he's got a video on it. There it is, banded joint mobilization. All right, so here's an example of using distraction.
If you have limited ankle mobility due to a joint restriction, you need
God, I freaking love this guy.
to perform banded joint mobilizations in order to improve that mobility. Foam rolling and stretching alone will not help improve this joint restriction. By using a band, as shown in this video, we are able to help improve the way the bones in our joint move on one another. In order to perform this ankle mobilization correctly, the band needs to be placed on the top of the foot or talus bone and not on the lower part of the leg. If you're doing this,
if you're doing it on like your full tibia, it'll pull, I mean, you're pulling like a huge bone. There's just not a lot of mobilization you can get there. But if you place it on your talus, it's much more effective.
Mobilization correctly, the band should take away that pinching or block sensation. Hold this end range for 5 seconds and perform 10 to 15 reps.
So that is a really great video. So there's a lot of examples of distraction that you're going to learn in Capstone. But if you have really limited dorsiflexion, that could be one of the reasons, and that could cause an ankle injury. Segueing back. So prevention, right? So we're going to see lateral ankle injuries that are really common. We are going to see lateral ankle sprains, medial ankle sprains, and high ankle sprains. Ankle injury prevention. Ensure proper range of motion of the foot and ankle complex. So it's kind of funny. We're not seeing very much difference between these two, right? Really, the big thing is like making sure that you have proper mobility here. So the most important versions of that for the ankle, though, are proper dorsiflexion, range of motion. Balance is going to be key. Making sure that you have proper balance, that you don't take a misstep. Strengthening of ankle dorsiflexors and inverters, right? You want to get good at inverting the foot, not everting the foot. And the performance of functional activities, which I won't put up here, but functional activities such as like, you know, core balance and reactive exercises, right? All right, let's look at knee injuries. Inverters. Yeah, knee injuries. So really common ones. This is a very, very commonly injured area, but we've got ACL, ACL tears, patellofemoral pain, right? So like, let's say you are getting like jumper's knee, runner's knee is another really common one. So like IT band syndrome, and meniscus tears. Okay, those are also really common. Mechanisms for like general patellofemoral pain. So if we look at like what I mean by that, we're talking about like a general aching sensation where your patella, which is your kneecap, is meeting with your femur. And so there's a groove here that you can kind of see. Well, not really. See how it's kind of shaded here? There's a groove that your patella kind of sits in, and it's supposed to be able to move up and down just like this. But if it gets out of that groove, so if we look at like poor patellar tracking, if that starts to move in any of the directions it's really not supposed to, like take a look here, kind of looks like it's kind of grooving on this side here, and there's kind of a gap on that side there. Basically, you're being pulled in any of these directions more than any of the other directions. So if you're pulling too far this way and not enough this way, you're going to have lateral tracking. The opposite could be true of like medial tracking. And so what happens is that patella, which is supposed to slide, you know, directly up and down along this line, now it's sliding out over here. And so it's starting to grind on this bone here. That often happens when you get overactive or underactive muscles in your quadriceps. And so again, when we see internal rotation here, and flattening, right? All of those things lead to poor patellar tracking. So what do you think we're going to see that is a risk factor? Excessive knee valgus, right? Abnormal tracking of the patella in either the transverse or frontal planes can lead to that. Knee valgus is huge. A decreased hip and knee strength is huge, or an increased Q angle or increased foot pronation, which an increased Q angle is going to be, you know, part of that knee valgus. Oh, I get a picture. So that's your patellar tracking there. Then we also see ACL tears. Man, this sucks. Look at this. 70 to 75% of ACL tears are non-contact, meaning nobody hit them. They just stepped wrong and tore their ACL. That sucks. Generally ACL tears happen during like either a straight knee landing, so landing with like a locked knee, and so then like there's a rotation that happens as they land, or it's more commonly during like a planting and like simultaneous cutting motion. So like somebody's juking one way, they plant really hard and try to turn and twist, and then that causes like an ACL tear. So your anterior cruciate ligament is this ligament that is running from the anterior side crossing, from the posterior side crossing to the anterior side in front of your posterior cruciate ligament. The reason it's called a cruciate is because it's like a crucifix, right? It's a cross. And so you anterior and your posterior cross each other like this, and they provide stability by pulling in opposite directions. Meanwhile, you've got these other ligaments here, right? You've got your LCL ligament, that's your lateral collateral ligament, and your MCL ligament, that's your medial collateral ligament. Any of these 4 ligaments in your knee can be torn, but the most common is definitely the ACL. Least common is probably the PCL. So risk factors, again, knee valgus, excessive rotation, and decreased knee flexion. And this is kind of a weird one, hormones. It's like, what? How the heck can my hormones have anything to do with an ACL injury? But particularly in female athletes who have like low body weight and maybe are experiencing what is called the female athlete triad, what can happen when you do not have enough body fat, you can have like a loss of like menstruation, which can then lead to like a reduction in hormones, which actually start feeding, and then your body starts feeding on connective tissue and muscle. And so you start to experience muscle wasting, you start to experience basically catabolized ligaments. And so then those ligaments are weakened and they are more likely to tear.
Hey Brad, because I was going to ask, in recovery, in the recovery phase, like during workouts, you know, protein helps with muscle synthesis, but does fat aid in the muscle recovery due to the hormone replenishment in the endocrine system? Would that be right?
Kind of, but it would be more like in your overall diet. You actually kind of want to keep fat away from your post-workout meal.
Okay.
Because fat is absorbed. It sort of gets priority when it's being absorbed. So then it will reduce your protein synthesis. So you actually want to you definitely want to have fat in your diet. Like, make no mistake about it. Absolutely, yes. But in terms of like post-workout meals, give it a little while. Wait a couple hours and then get like a high-fat meal.
Okay.
You don't want it to interrupt protein synthesis. You don't want it to be in the way of absorbing protein.
And then carbs will be the main source of fuel for working out, right? And
Yeah,
fat will
your
be,
next workout. Yeah, you're great at absorbing carbs like post-workout, and so your body is like, great, restore all that glycogen so we can work out hard again tomorrow.
yes.
That's one of the reasons why carbs are so important post-workout. Most people don't consider it. It's not about the workout you just did. It's about tomorrow's workout. You want to make sure your glycogen is restored so you can work out again.
Yes. Okay. Perfect. Thank you, Brad.
Yeah, no problem. So let's look at prevention, right? Let's talk about how to like prevent runner's knee. Let's talk about how to prevent meniscus tears and ankle tears or knee tears and all these things. So knee injury prevention. Guess what? It's going to be proper range of motion again, but a little bit different this time. So ensure proper range of motion and stabilization of the knee, of the hip and knee complex. So your hip has a lot to do with like your knee's ability to stabilize, right? If you have weakened or strengthened muscles in the hips that are pulling in the wrong direction, it can be very, very common for you to experience a knee injury. So particularly weight-bearing exercises for the hip and quadriceps region are key due to their ability to strengthen those areas. So particularly like weight bearing is great because like one of the reasons we love barbell squats so much is because like it's just really great to be able to throw a lot of weight on, and that creates stability in the entire patellofemoral region. So weight bearing exercises in particular are really great because of how easy it is for you to make them more intense. And then obviously correcting faulty movement patterns is going to be huge. So looking at like somebody, the way they run, performing like a gait assessment and being like, oh, you're a scooper, right? That thing I was talking about on Friday. That is causing like, you know, you have this knee valgus while you are mid-step during your run. That's a faulty movement pattern, right? So correcting faulty movement patterns are going to be key. I'm going to add a couple here, but also performing stabilization and balance exercises is also going to be absolutely key. And then strengthening the lumbopelvic hip complex. Strengthening your glutes, strengthening your core, all of that is going to be key for preventing knee injuries. And I know we don't really think of the knees when we think of our core, but remember, like your core determines like everything that's below it and everything that's above it. So your knees being below, there's definitely a lot to be said for like how your glutes affect your knees. No, they're not directly connected, but one affects the other in terms of how it moves. Then we got low back injuries. Oh Lord, we're into my territory. Right, low back injuries. Problem with low back injuries is once they happen, they last a really long time. It takes 4 to 6 weeks to come back, and affects a pretty good chunk, 4 to 6 to 15% of athletes every year. Very high incidence of reoccurrence, similar to our ankle injuries. And the problem is that it can often lead to arthritis in the low back later on in life. So some of the most common are things like disc injuries, which are things like herniations, or slippages, slips, and tears, right? So like, those are all basically the same thing. A herniated disc is a tearing in that lining, right? So, or a slipped disc is really pretty much the same thing. Maybe it's not quite as severe. But disc injuries are very, very common. Usually what happens is like excessive compression of the spine. So somebody has like, let's see here. I'll show you like spinal arthritis. When you look at arthritis of the spine on an x-ray, okay, well, that's actually not what I'm looking for, but that is intense. When you look at, oh, there we go. So when you look at look at how much space there is in between every one of these individual discs, but then look here, see how limited space there is there? That's spinal arthritis. There's really just not as much health in between each of those discs. And so they start to like compress, and that can lead to bone spurs and all kinds of other things, right? Now you can understand how like these individual discs, when there's very limited space like that, it's very easy for them to herniate. So if you look at your spinal discs, right, they are literally this circular, cushion in between each of your individual, pieces of your spine. And so like this is supposed to provide stability. Now look, these are all nerves running near. If you tear this and this liquid material starts to like leak out and touch those nerves, that's what causes that really sudden like painful sensation. So like people who have, let's see, a herniated disc, what that is it's a torn disc where this stuff starts leaking. Oh God, has my internet died? No. Okay. Yep. Okay, hold on. Wait for it. And we're back. So this is a herniated disc, right? This pink lining called the annulus gets torn, and this, what is called your nuclear pulsus, starts leaking out and touching these nerves here, and that causes pain. Sciatica, same concept. Sciatica is really, really similar, where your sciatic nerve, which is the one that runs all the way down your leg, you have a herniation, and that starts leaking out and poking that nerve there, which then travels down the leg. Or where is it? Or it's where the piriformis muscle is actually poking that nerve. That is called piriformis syndrome. So anyway, all of those are common low back injuries. And so the most common version of this, and the way to avoid this, is going to, wait, oh, I forgot about just straining your muscles as well. So disc injuries are going to be common. Muscle strains are going to be common, like literally just pulling a muscle in your low back. If you've ever thrown your back out. I remember the first time I ever threw my back out, I was a kid, and my dad paid me to mop out all of the trailers at my dad's moving company, sweep them out and mop them out. And I wanted to get done really quickly so that I could go play with my friends. And so I had like the broom and I was like a cartoon character sweeping like this and mopping like that because that's how they did it in the cartoons. And I completely just way too much like lateral motion. I was fine the day of, but when I went to bed and woke up the next day, whoo, threw up my back. And I was like a little kid. So that is a very, very, very common type of injury that can occur. Usually it's due to underactive muscles and poor activation techniques. So a lot of times your core wrenches down, which moves your spine rather than stabilizing your spine. And then we also see sacroiliac dysfunction. So SI joint dysfunction. I should put sacroiliac dysfunction or SI joint pain. Man, I don't normally have SI joint pain, and I've been dealing with it because of this whole pandemic, just way more sitting. But SI joint dysfunction. Your SI joint, it is where your pelvis comes together with your sacrum. It's your ilium and your sacrum, so it's your sacroiliac joint. Okay, that's your SI joint. And basically you'll see people who have like, this is kind of weird. I know this is especially weird to do on camera, but you can always spot somebody who has sacroiliac dysfunction. They'll do it in one of two ways. They will either do what is called a list, where they will walk kind of like this with kind of a weird angle, where they're kind of like tilted off to one side. That's called listing. They are listing to one side. Or you will see people who do a walk kind of like this kind of over-exaggerated, like sexy walk. Like, that is actually SI joint dysfunction. They're basically moving this whole thing as like one big joint rather than having the ability to do just the little bit of flexion that it needs to do. So when you see somebody do that kind of weird side-to-side walk, that probably means that they have some SI joint pain. So how do we avoid all of this stuff? You're probably like, well, do some freaking planks. And you are right. So low back injury prevention. It is going to be ensure proper range of motion again, but particularly you're going to focus on flexibility in your overactive muscles and strengthening of your underactive muscles. So proper extensibility and overactive muscles and proper strengthening of underactive muscles. Also proper stabilization, developing proper neuromuscular control and core stabilization is going to be key, but also then mobility in overactive muscles and strength in underactive muscles. Both absolutely key concepts. And lastly here, we've got the shoulder pain. Good Lord, this is another one that's common in sports. All right, so shoulder injuries cost $39 billion a year. That is insane, right? Occurs in about 1/5 of the population, about 21%. The most common are going to be shoulder impingement and shoulder dislocations. So shoulder impingement and shoulder dislocations. Shoulder dislocations are like obviously super severe. That is literally your, freaking arm falling out of the socket. But generally, the biggest things we're going to see is shoulder impingement. And shoulder impingement is just where you develop overactive muscles that mean that there's less space in the joint, and that causes like a general rubbing and painful, general rubbing and pain. So shoulder impingement syndrome, if you take a look at it, I always like to call it like impingement, because that's really what's happening, is like all of these materials are being pinched. There is not enough space. It is often caused by like weak rotator cuff muscles and overactive upper body muscles. So taking a look here, repetitive compression due to like repetitive overhead motion. So if you are performing a lot of like overhead motions improperly, that can often lead to that, or just general instability of the shoulder. So how do we fix this darn stuff? Shoulder injury prevention. Again, proper extensibility of the shoulder complex and strengthening of upper back musculature is going to be absolutely key. So, corrective exercise on overactive / underactive muscles is going to be key. So again, strengthening the underactive stuff and loosening the overactive stuff, but also rotator cuff strengthening and stabilization. That is going to be huge here when it comes to like shoulder impingement. So working on external rotation is going to be key. External rotation strength. And then one other one that's going to be big, and you can see it up here, is scapular strength and stabilization. So remember, your scapula is there to like provide static stability, but also is designed to move through full ranges of motion. So if you can't do that, you're not going to have the ability to kind of open up that shoulder joint. There's a difference between your scapula and your shoulder joint, right? Your shoulder joint is what meets with your scapula, but your scapula is what meets with your entire upper body. So if that scapula is sort of in a locked position, being pulled forward into protraction, it's not going to allow you to open your arms effectively. So you need to be able to roll your shoulders down and back and sit in that proper range of motion. And that's that, guys. There is cervical injuries, but you're going to get in those in capstone. This book doesn't really cover a lot of the next stuff. Questions, comments, concerns? How you guys feeling today?
Feeling great. Great.
I only had my internet connection crap out twice today, so I will take it. My internet guy will be here on Wednesday, everybody.
You'll be all refreshed on Wednesday.
I will burn, and if it doesn't work, I will burn them to the ground. All right. Well, so look for homework number 4 going up today. Last piece of homework. We've only got one more PowerPoint left in this whole course, where we get a little bit into, I believe it's nutrition, right?
Okay.
Yeah. Oh wait, no, I'm sorry. Today was the injury prevention stuff. So we're not covering nutrition. So we got our training session practicals. We don't have any PowerPoints tomorrow. We've just got the PowerPoint, and I'm going to show you guys how to get your practicals tomorrow. We're going to do a million examples of writing programs. So it'll be a lot of stuff kind of like this, but much more organized, much more clear, and with full actual workouts. So we'll do big chart day tomorrow. And we will do sort of program design stuff tomorrow. But big chart day will probably be review because we don't have any new students. So we'll move through it pretty quickly. I'll probably just even use like a pre-existing one. But yeah, that's it. I'll send out the email here in just a little bit. We'll see everything up on Canvas. You guys can knock out homework 4, and I will see all y'all tomorrow.
Wait, Brad.
Wait,
Brad.
Yes, what's up?
Sorry, I was curious about what you had to say regarding the question I had.
Oh, yeah. Here, let me end the recording. Let me kill the recording, and then we'll go into it.
Okay, cool.
All right, see you tomorrow.